Welcome everyone to our event today, Institution-Led Social Reform and Justice, Modernizing Gender Expression on Government-Issued ID. We are so glad you could join us. My name is Helena Jolly, and I recently completed my PhD from the Institute for Resources, Environment and Sustainability at UBC. I'm the lead at the Collective for Gender Plus Research, Office for Regional and International Community Engagement, ORIS, at UBC. This event is co-hosted by the Collective for Gender Plus Research, based in ORIS, within UBC School of Public Policy and Global Affairs. Before going further, I want to take a moment to acknowledge that the UBC Vancouver campus is situated within the traditional ancestor and ceded territory of Musqueam. Since we are on a virtual platform, I would like to invite you to reflect upon the indigenous lands that you are on today as well. A few housekeeping notes. This event will be recorded and later shared with all the registrants on School of Public Policy and Global Affairs website. We'll be welcoming questions later in the program. So please feel free to submit these using your Zoom Q&A function at the bottom of your screen. You're also welcome to turn on closed captions using CC button. It is now my pleasure to introduce our panelists today. Natasha Tampiraja is an adjunct professor and SPPGA practitioner fellow as part of the 2022 SPPGA practitioner fellowship at UBC School of Public Policy and Global Affairs. Natasha is a third-generation public servant and has worked for the province of BC since 2006. Over the past 15 years, she has led nationally recognized examples of transformative, citizen-centered public policy, including the prize-winning BC Services Card and the modernization of gender identity expression on government-issued identification. Welcome, Professor Tampiraja. The second panelist, Dr. Daniel Metziger, is a clinical professor of pediatrics at the University of British Columbia and a pediatric endocrinologist working in endocrinology and diabetics unit at BC Children's Hospital. Dr. Metziger and his colleagues, in collaboration with the hospital and community-based mental health professionals, began seeing transgender kids in 1998, and they have now seen around 700 trans and gender non-conforming children and youth in BCCH Gender Clinic, one of the busiest in Canada. Welcome, Professor Metziger.
Thank you.
Now we have Grace Lohr, who is the Parliamentary Secretary for Gender Equity. She was elected as an MLA for Victoria Beacon Hill in 2020. She has been a dedicated anti-violence advocate, university instructor, and community organizer. Before election, Grace sat on the Fernwood, North Park, and Quadra Village Neighborhood Planning Group and was on the National Advisory Panel for the Canadian Women's Foundation and Affordable Fernwood Organizer. She has worked closely with Victoria Sexual Assault Center and other anti-violence organizations to support inclusive, accessible, and survivor-centered sexual assault response. At the University of Victoria, she taught Canadian politics, gender and politics, and research methods. Her research has focused on social media harassment and online violence. Welcome, Grace. Well, now we'll begin with a few questions for the panel. If the panel is ready, the first question is, we have three panelists with us today who each played an instrumental role in modernizing gender expression on government ID in BC. Tell us about your role in the process, challenges you've encountered, and lessons you have learned. I would suggest if Natasha, Daniel, and Grace can answer in that particular order, that would be great. To you, Natasha.
Thank you. So in terms of my role, I was the policy lead at the Ministry of Health for the BC Services Card project 10 years ago. The Services Card was the first example of a multi-party integrated service delivery model in Canada. So in other words, we had three distinct bodies in government, the Ministry of Health, ICBC, and citizen services, leveraging the respective strengths to deliver a single product. It might kind of sound strange to those outside of government, but that's actually extraordinary. We typically stay within our realms and do our own thing. So one of my jobs was to harmonize identity policies to make the card work. I quickly realized we did not have matching policies for gender and sex. The biggest difference being that the Ministry of Health and Vital Statistics legally required completion of reassignment surgery. So that means you are physically altering either your upper part of your anatomy or something in the bottom ends before we change your record. The law also required you not to be married and to get somebody to verify that, but in practice, no one actually enforced that. ICBC, so in charge of driver licensing and government ID, just wanted you to promise that you would. So I worked with the health sector, government, community advocacy groups, and clinicians to modernize the policy. We abolished the legal requirement for reassignment surgery and recognized the rights of transgender kids. I want to emphasize, to me, saying I all the time is really strange for me because this was not a solo effort. I had really strong executive leadership around me, notably my former boss, who went to extraordinary lengths to champion this, and the Registrar General of the Vital Statistics Agency, who became one of our strongest allies. Challenges, 10 years ago, the subject was still relatively obscure in Canada. You know, I think we take it for granted now. Many of us show our preferred pronoun in email signatures. That certainly wasn't the case back then. And this lack of awareness and sort of cultural common sort of space translated in several ways back then. Some folks had a tough time talking about the difference between sex and gender, and then making that leap to link to why it doesn't make sense to ask people to have reassignment surgery. The inclusion of children was really risky. And, you know, perhaps I should have prefaced this all by saying this really hadn't been done yet in Canada. So this was edgy from a social progressive perspective. There's also no good data. So, you know, when we think about expending our efforts, you think, okay, well, who are we serving? And so because of a lack of data, some thought, well, this is like a tiny population, so why focus all this effort, you know? And so some of the lessons we learned was, and this will not be a surprise to many of you, you know, policy making, you know, that's worth making anyways, is always a marathon, and this wasn't different in any sense. Time was needed to build relationships, to build trust, awareness, and understanding, and where possible, compassion. This was really a change management exercise. So it was really about changing attitudes and also building understanding, because how many people did we know back then that were involved in this that actually knew anybody who was transgender? And of course, Daniel was going to talk to you about that. I think the other lesson learned was, you know, we read theory, gender theory. For any of you that read gender theory, talk about the importance of institution-led reform, the trickle-down effect that you experience. It's not a very easy argument to make in the public policy space. It feels too abstract. So some of the ways we found success was to link it to the major project objective. You want everybody to get a photo services card? Awesome. Well, if we don't do this, you're going to be leaving people behind, and we don't know how many. The other context at the time was there was a human rights tribunal case in Ontario where somebody was challenging this, and we could point to this and say, well, it's a matter of time before someone gets the idea to do this here. So we can either do this ourselves and save taxpayers the cost of an unnecessary court event, or, you know, the alternative. The other quick thing I'd say is evidence-based was really helpful. We were not the first. Other places around the world had already done this. Australia was already implementing X-gender the year we were doing this. And the transgender experience and the transgender voice was also really important. So we worked with advocacy groups like Community to seek advice. The researchers, because there was a paucity of evidence for North America, they had to actually call DMVs to get evidence to understand, well, what do you need to do to change your gender? Many people assumed the person calling was transgender. So we had an eye-opening view of how some public servants, you know, treat transgender, some of them quite nice, maybe some others not so much. And then I think the last thing I'd say is the reinforcement. So you just can't write a policy and then let it go. You need to work with the people that are going to operationalize it, help them write call center scripts, think about what the form looks like to fill this out, to ask for the change, what design. And the result, was in the following years, 9 provinces and territories followed our lead. It's a pretty big deal. If you think about the way Vital Statistics Acts work in Canada, they're mirrored, so they all look the same because we all need to have similar birth certificates, right? We're all Canadian. So I mean, legal change happened across Canada. And I think, to those who are worried about, how many people are there? What we've seen now, since 2014, which is when it got implemented, over 2,400 people have changed their record of gender at BC Vital Stats. And in the decade before we did this together, only 60 did.
Thank you, Natasha. 2,400, huh? That's a huge number and very impressive number. So now we have Daniel. Would you like to continue with the answer to the question?
Sure. So Natasha, some random person named Natasha just emailed me one day and said, "Hey, we need your expertise." I followed, many children who are trans and gender diverse, and we did also have representation from adult caregivers and from Trans Care BC, which was just sort of getting up and running at the time. What is the lived experience of adults and trans youth, and what practically speaking did these folks need? And at the time, ICBC actually was really good. They would just change kids' driver's licenses with a letter. They would change the gender, and they couldn't change the name, but they would change the gender for us. And that was super helpful for the teenagers to at least have a gender marker on their driver's license, because that's like their main ID at that age. There was sort of a back way of doing passports, but it was kind of backwards and it was kind of under the table, but it would work. But there's really no way of changing the sex on the sex marker, gender marker on a birth certificate. So it was just one more, and kids aren't going to get surgeries to have that happen, right? So it was one more hurdle for families and kids to have to go to the United States with this birth certificate that generally matched how the way they looked and the way they identified and stuff. And there was, there were risk elements of in case there was lots of just like discomfort and just like one more microaggression, or this is more of a macroaggression that they had to deal with, like this paperwork that didn't match. And so, what Natasha and the government folks brought forward was super sensible, pretty low barrier. The paperwork is dead simple. It's $27, which was, way cheaper than changing your name. And, nobody's going to be 100% happy with whatever you come up with, but our parents were very happy to be able to do this. There is even some, places where you can get your $27, not officially, but there are, funds that people make available for families who are really can't afford the $27. And you can do it more than once too. Although I haven't had too many kids do it more than once, change one way, change backwards, or change to X as that became available. So it was just really very well received, I think, both on the adult and the pediatric side of trans care, just to make it simpler, but also to show that our government really cared, that there was that we were kind of leading the way. And within a short time, Ontario was like calling me and saying, "Hey, this is what you guys did in BC medically. How did this work? Because we want to get our doctors online." And so, and really now that I fill out these forms across the country, they all look the same. You kind of know where to sign and what to put in the number, because everything's kind of based on the paperwork that Natasha and the working group came up with to do this.
Can I just jump in quickly to just respond to something Daniel just said? The reason why it was so easy to find Daniel was basically, it was like finding a unicorn. It was just so obvious once you saw it, because he and the other clinicians that worked in this field were so revolutionary and so passionate. And they were so pivotal in helping us persuade executive of the rightness of this, and that, changing the perception this was a medical issue to one that was a social and cultural one. So, Daniel, I can't emphasize how important his contribution is. He's such a humble person. He's not going to tell you, but it's true.
We don't get lots of intervention from government, so it's like, oh, some ministry that's not health is calling me. That's interesting. Okay.
Mm-hmm. Yeah.
Thank you, Daniel. as a parent myself, the knowing the ease of, going through this process, and, it's way more easier the way you have explained it. It's really such a genuine thing and such a brilliant thing to know that it's so much easier for parents like me to go through these processes. Thank you. And now we'll hear from Grace.
Thank you so much. It's such a pleasure to join this conversation today. I'm calling from the territory of the Lekwungen speaking peoples of the Esquimalt and Songhees nations. And it's just really a privilege to listen to my two fellow panelists here. The heavy lifting that was done on this file by these two well before I came on the scene as parliamentary secretary. I appreciate the chance of hearing that process to get where we were when I had the privilege of taking on this role. And I'll maybe start by referencing my predecessor, Parliamentary Secretary Mitzi Dean. She was in the role when we moved to add the X gender marker, and I know this was something that was really important to her. We see in this moment, in this collision here, the medical side, the expertise of working with kids and families, of the public service side, and then of the desire of those of us elected to see these things through. I think just to recognize Mitzi Dean there and the importance of her coming in and having the chance to hear from the folks like the two people joining me here, as well as others who wanted to see this happen. And I know it's made a difference. I know it's made a difference to people in my personal life, certainly in folks I connect with on the regular as parliamentary secretary. One thing I also wanted to say was I'm the Parliamentary Secretary for Gender Equity. I'm not the Parliamentary Secretary for women's issues, which is the case in some other provinces. I'm not the Parliamentary Secretary for Gender Equality. And these titles are intentional. And for me, as a cis ally, I take that part of my job, my role, very seriously. So it's been my job since I was elected in 2020 to continue to bring issues around government. And Natasha spoke about the collaboration that happens between health and ICBC and vital stats, and that is kind of rare and essential. And so I have the opportunity to move around government where there's, the average person's experience with government isn't one ministry at a time. We cross over, we interact, and it's certainly the case with folks looking to access gender affirming care, which we made available closer to home here in BC because it is the care and support folks deserve. Folks wanting to change their gender markers. Again, this isn't housed in a number of different spots, so that connection is important. And so to the next steps that we've made recently is, this ongoing commitment to listening to folks about their experience of changing their gender markers, of being recognized as government as who they are, for who they are, with respect and dignity. And so community, absolutely, other pride organizations, individuals who reached out to me in the Gender Equity Office to share their experience of what it meant to be recognized properly on their ID, but also the ongoing challenges that they faced. And so one of those was the remaining components of this that were medicalized. So the need to have a doctor's note or a physician or a psychologist note. And for some people, that continue to be a barrier with the challenge of finding a doctor, of not being sure whether the person, if you don't have an established relationship, whether someone is competent or possibly toxic or not safe. And so that for some folks is too risky to put themselves in that position to get that documentation. And so in January, we were able to, working with partners, working with experts, remove that requirement for everybody over 12, so that with all the heavy lifting that has already been done over time, we're now at a spot where we could say, you tell us who you are and we believe you. And that's, you know, your gender, and that's all we need to go forward. And so that change, it came in effect in January. And I heard from people shortly after that people had booked appointments to go to ICBC because they wanted to do this, needed to do this, and didn't have that piece of an application. And so the removal of that was still another thing forward. And I'll be very curious to see what those numbers look like that you mentioned, Natasha, over the next year. Thanks.
Thank you so much, Grace. Taking the time into consideration, I'll go into the next question. If the panelists can answer to this question briefly, that would be very great. So next question is, we have a clinician, politician, and an academic at the table. Could each of you talk to us about the influence your background and academic history had in your role in modernizing the identity expression here in BC? I'll start with Grace and then Dan and Natasha. Thank you.
Sure, thank you. So I'm a UBC alum 2 times over, did my PhD in political science, walked through these different spaces of academia and politics and also frontline work. And I'm a believer that the moving between those spaces as individuals, but also in the work we do with each other is really essential. And so, you know, as I said to start, I'm grateful for the other panelists and the expertise that are here, because we have so much to learn from each other and to continue to make those connections. For me, I'm very much committed to soaking up the expertise that's in community, that are experts serving kids and families, that are deep into the research on these issues, to inform the work that I do in and around government.
Thank you. Dan?
You know, you can't work with trans youth and families without all of a sudden becoming an advocate. And sometimes that means advocating in schools, local governments, churches, sometimes in the bigger levels of government. And so I think, you know, we're sort of the one step that's kind of between decision makers and families. And we see, like, you know, firsthand what the families need, or the adults need, and what the barriers are. And so I think that's been important. I see one of the questions that there's this whole medical bit about changing gender markers and how that affects lots of other things, including our lab results and things like that, because there are actually a number of medical downstream effects of changing a gender marker when you're interpreting blood tests that come to you in the lab that all of a sudden have the gender that matches the person's identity but doesn't necessarily match our physiology. So I think you know, medical people have been part of that decision making for that reason as well.
Thank you, Dan. Natasha?
Yeah, I think there's a lot of hybridity here, you know, like academics melding with, you know, the political realm, academics melding with the public service realm. And so for me, I think before GBA Plus became a thing, I was an academic, and so I was focused on ethnic conflict in South Asia. And so there was loads of post-colonial writings on gender by people like Geetha and Jayawardena, so that never left me. So I'm just, again, going to put a shameless plug in for the value of the education in humanities, because it helps you see the world through different lenses. And even if it's not part of your walked experience, like, you know, Grace mentioned the cis experience, I'm cis too. You can step outside of yourself to appreciate maybe a different perspective and to critically interrogate narratives that presented to you. I think too also personally, I just can't stand when I see this kind of sort of injustice, whether it was blindly done or knowingly. So in this case, let's say blindly, because I think that would be the right way to go. And I think sometimes now, particularly in this space where we're seeing the rise of xenophobic behavior, nationalist behavior, you can kind of choose to ascribe to a particular group or tribe, or you can think about what kind of pulls us together. And I'm a woman of color living in a Western country. I know what discrimination feels like. So could it be such a stretch, how painful it must be, and like what it might do to you if you're just not even being recognized or allowed to do something this basic as assert your preferred gender identity.
Thank you, Natasha. Thank you, panelists. Now we move to the questions specific to each panelist. This question is for you, Grace. Before you entered political realm, you had a career in academia and policy research. So you have the benefit of perspective in both areas. As policymakers, we would benefit from learning how to work better with decision makers such as yourself. With both your academic and political background in mind, what are some of the best practices in the space?
This is such a good question, and one I think about a lot, and I'm not sure I have all the answers, except to say that I have a commitment, having done that work, I have a commitment to myself and in this work that I need to continue to make space in the process of my work to hear from and connect with folks. And I have to tell you, like, I have meetings all the time with frontline service providers, people with lived and living experience, academics, and I am learning always. So I feel so lucky to be in this position where I get the opportunity to soak up what experts are saying. And I use the word expert in a variety of ways, because people are experts in their own experience navigating systems and such. And then for me to then turn around and talk to my colleagues in government, in cabinet, about what we do with that expertise. And so I think the more that students and academics and folks working on front lines can do to reach out to the elected officials that are responsible for the area you're working in, or that are your local MLA, and ask to have a conversation, to share some of what you know. We are 1,000 things a mile coming at us as well. And so we do our job best when we take in what's coming from the expertise in community, from academics, from frontline service providers. So I'll maybe leave it there, but just a real encouragement for folks to share what they know in a bunch of different ways, participate in the budget consultation process, participate in when there's other consultation happening. We just went through a bunch with the review of the Police Act. Tell us what you know. And for me, I will be committed to soaking it in.
Thank you so much, Grace. If I can give a quick follow-up question on that, can you tell us about some of the misconceptions you had about politics? With the benefit of hindsight, you now understand.
Oh, this has been such a steep learning curve that I don't know if I could list one or two, but I have been thinking about this question because I have a PhD in political science, and still I'm figuring out how to do this job effectively every day. So the challenges of navigating ministries, of making sure that the priorities that you're hearing from people, whether it's about gender affirming surgeries, whether it's about ensuring that gender markers are changed, not just on ID here, but throughout the systems, that you're pulling that in, and then I'm always learning about how to take those through the system. So the collaboration, relationships, humbleness and openness to learning. These are pieces that I have had to keep close in that transition from academia to politics.
Thank you, Grace. Next question is for Dr. Metziger. Since modernization of gender expression and on government ID started 10 years ago, what changes did you notice in your practice then, and how have the most recent changes impacted your practice and patients?
So, as Natasha mentioned, in 2012, 13, when we were doing this, there was very little evidence that we were doing is right. Since there's really very strong evidence that children who can safely socially transition, so change their name, change their dress, change their school uniform, change their gender if they gender marker if they choose to do that, that those children do just as well as their cisgender peers at school in terms of mental health and school attendance and all of the markers of being a happy, healthy child. So I think anything we can do to reduce those barriers is obviously is important. And I think it's also way less paperwork for me to have to write separate letters to ICBC and to the government and to the passport people. It's much simpler just to do it once. And also to just back when was changed here, to tell my colleagues across the country, well, you got to get your vital statistics folks on board because it's really simple here. And then Ontario came, and then the other provinces followed. So I think also is just helpful on a national basis to have the physicians who are doing a lot of paperwork to fuss and say, let's standardize this and make it across the country. The Yukon has done exactly the same thing. I see lots of kids from the Yukon as well.
Thank you, Dan. Next question is for Natasha. Why didn't you include gender X option or demedicalize a person's assertion for their gender 10 years ago?
That's a good question. I like it. I think it was Dan that said it earlier. Whenever you do a public policy, there's always somebody that's going to be annoyed with what you did. There's a number of reasons. So I'm not sure that it's possible to do, a perfect public policy because there's always trade-offs, concessions to be made. As Dan pointed out, there was evidence 10 years ago, almost to the day, to support, both of those ideas. And for both of them, somebody else in the world had either already done it or were contemplating it. So here in the case of BC, in the case anywhere, the successful policymaking that leads to actual implementation, it's always a compromise. And at that time, we felt it was more important to include children. So that's what we really advocated for. We did want a non-medical model. We contemplating having X gender. But the world is full of dusty policies on shelves that went nowhere. I'm not interested in contributing to that. And neither was anybody else who worked on this project. I also think just thinking about the context of the time. So the DSM-4, so this is, to spell that out, that's the Diagnostic and Statistical Manual of Mental Disorders, had just been released at the time we were thinking about it. So the fourth version of that. And so for the first time, transgender was just the state of being transgender. It was no longer some sort of mental illness, right? So if you think about this contextually in this space, it's not until the 70s that being gay is no longer a mental illness. Like if you're experiencing, and Dan can talk better about this than I do, but if you're experiencing some kind of mental distress because you are, okay, but you being in the state. So that's a big deal. Because you think about this, think about all the clinicians that are out there that are just trying to do the best. They need points of reference. This is a major one. So it's happening right when we're trying to do this. Not enough time had elapsed to demedicalize. So that was the other side of it. And so, you can, I think what I'd say is, you can choose to die on a hill and then the whole thing gets scuttled. Or you can choose the path where you don't get everything done at once and you try to engineer it in a way so that it leaves doors open for people like Grace and I mean, I was far away from this file at the point at which changes like X gender and then the work to demedicalize the model. That's a decade later. That had nothing to do with that. There were like really bright, clever people and passionate people that came afterwards to do that. And sometimes you just have to really hope that that will happen, and it did. But yeah, I think the main thing is you just can't be that big of a hero or anything, or try to change everything all at once. You try to nip around the edges, I guess is what I'd say. Yeah.
Do you mind if I jump in there on that quickly? Because I think
Yeah.
it's such an important point, Natasha, and letting the perfect be the enemy of the good, and moving things along. And you know, like I said, starting out, I was far away from this when you were both doing this initially, but I was able in this role to pick up after now Minister Dean worked towards the X option, and then to go to Vital Statistics to talk to health, to enter into the process that so much time and heavy lifting went into, and then move on the medical model bit. And we're always looking for opportunities around government to do more, to do better. So we had this work that was done 2012, 2014, Mitzi, Dean, and all the incredible folks in the public service get us to X. And then, you know, I can come in and pick up from the advocacy, from the leadership of trans communities, from individual people sharing their experience, and move us more. And we're not done now. There's work to do across systems. There's work to do, particularly in the health system, but also the education system. So to Daniel's point, kids, youth, and adults are able to safely and socially transition in a way where when they interact with government, we see them as who they are, for who they are, and with that dignity and respect.
Absolutely. I think the idea of thinking it's done is, you know, a good thing to avoid, and I totally applaud you. Like, absolutely.
I would also have to say, just in fairness, like, not that there was nobody that was non-binary 10 years ago, but I don't think it was at the forefront. And as you know, the term non-binary was not really very much, even in sort of trans care circles, it wasn't as coming around so much, particularly not in kids. So I don't think the demand was there as much 10 years ago, as it became much more clear that there is now a demand, or from some folks who identify as non-binary, or who don't choose not to have an M or an F gender marker.
Yeah, I would definitely echo what Dan said. That was something that wasn't coming up back then. But yeah, I support.
All the more reason for us to look for additional opportunities, and to be nimble, and to respond to people when we're hearing what they need going forward.
Absolutely. The best kind of public policy and law is one that's a living tree. It evolves with the societies and communities it's supposed to serve. Absolutely.
Thank you, panelists. I'm learning quite a lot. I'm sure like the audience are also learning quite a lot from you guys. Wonderful insights and incredible work and support that you've given to this process. Really kudos to all of you. Thank you so much. Now we'll open the questions to the audience. What I'm going to do is I'm going to read the Q&A from the Zoom out loud, and panelists can decide who wants to answer the questions, or if all three of you want to answer, please go ahead to do that. Let me just read the questions. First question is from Amal Iza. What are government's priorities now in this area?
I'll assume that's a question for me in particular. Lots. demedicalizing the process was a piece working with my colleagues and with Vital Stats and others that we knew we could move on. And other things are slower and a bit of a grind, and I think Natasha called it a marathon. So we wanted to do the thing we could do now. So a few things. We know this is a challenge in health records, and when people go to doctors or the ER or beyond, having that change of gender, change of name disseminate. We know that we don't have the X option in all government systems. So what we're working on is a sex and gender data standard, so that we have, informed by what community is looking for, what will serve people's interests when they're interacting with government, policies and practices that are consistent, that are predictable, that are asking people the question we actually need. I was just reflecting on one of my kids' forms for school, asking the sex of their sibling, and is this a necessary piece of information? Like, no, right? But it's just always been on that form. So how do we build the best practices so that we have the information to serve people in the way they need to be served, and not other information. And then we're doing that in an inclusive, respectful way. So that's the piece that we're working on that will filter out into some of those other priorities. I could speak to ongoing efforts with Transcare BC, again, the move for lower gender affirming care in province, and top surgery available in more locations. These are always pieces, and I'll just say in general for the trans communities and non-binary communities, a lens to all the work that I do, from pay equity to the gender-based violence action plan.
Thank you, Grace. Next question is by Ian. Why have a gender marker at all? Doesn't seem to be that helpful in identifying a person over and above the other information on the ID. Any panelist can answer. Dan, do you want to answer? I don't want to put you on the spot, but.
Well, I think there's a different question, like, do you need to have it on your passport or your driver's license? I could let somebody else answer that. Like, I'm an endocrinologist. I see boys and girls and trans youth and cisgender youth, and much of what I do is gendered. Like, height is gendered, hormones are gendered, puberty is gendered, thyroid is gendered. So for me, it's important to know the kid's hormonal status, which may involve being cis or trans, may be involved on hormones, not on hormones, may be involved in normal physiology, abnormal physiology. So for me, I have to know that. It doesn't, I don't care what's on your passport. I think international standards cares what's on your passport. But we do have to do this. And this is where actually, like, Natasha and company have made my life more difficult because of our forms. We will put some letter on there, but it doesn't match the kid's physiology. It might match their brain, but it doesn't match the rest of what's going on. So as Grace mentioned, there are efforts going on. Transcare BC and has been working with, shout out to Life Labs, because they are actually very interested in solving this problem too. How do we get lab results that match the person and not their gender, brain, surgery, anatomy? It gets really complicated very fast. And you can out people by having gender markers that they are comfortable with, but then all of a sudden there's a piece of paper that's maybe not ready for people to know that their gender is this, that, or the other thing. So it's a super complicated area. And you think it would be super straightforward. F, okay, let's add an X. No, there's many layers of complication that I did not even appreciate until this bigger panel of people came together, and they're like, but did you know, if you go here and they see an X, you're going to get arrested. Oh, right. Yeah. So, you don't want to travel to certain countries with an X on your passport. That just is not going to be very good for you. But neither is an X on a lab report either, right? Because then I have to learn about the patient, which of course I can do. But when I'm getting sent referrals, I can't like be calling everybody up and asking, what do your genitals look like and what hormones are you on and what was your chromosomes? So we have to have that as a sort of a starting place. Does it have to be a birth certificate? Maybe not.
Maybe I'll answer this from a slightly different perspective. I think for some people it's really important because I mean, Daniel's interaction with people is different. But if you're, going, needing to show ID to go into a bar, or you get your driver's license and you're using it to access something and it has your correct gender on it, it is a piece to be recognized by others. So for trans folks and often from trans women, that it's a really essential piece of recognition and validation and proof out in the world of who people are. I'll say that it's been my experience in conversations that there's a lot of different takes on this, on the benefits of having them, on what it's, the potential harm it does, the harm of not having it there. So I don't think it's a settled question, but I think that's part of the answer from my perspective.
Yeah, I really appreciate the comments from Daniel and Grace. I think Gracie said it so well in saying it's not a settled issue. We knew, and I think, there's two parts to this. There's the considerations in the health sector, and then there's considerations for everything outside of it. So why have it at all? If you think about just getting on a plane to travel, passport issuance, driver licensing, there are national conventions, there are transnational, and there are continental regulations that govern these things. So what you have to show to get on a plane is agreed to by multiple continents. I think it's divided up in 4. So to change what they think, I mean, I could make that my life's work. I mean, Grace, you can hire me. We can just, spend the rest of our life doing this. And I sound like I'm making a joke about it, but it would be a lifetime's work to change that kind of stuff. And so to a certain extent, we're constrained by national, continental, and then global considerations for how people need to move around. You want to go to another country and show a driver's license. That's the reason why you can drive. It's because we all agree on certain things that have to be on the ID, which may not sound like a very satisfactory answer, but that was something we learned through this process. So that's the first piece. And then I think to Dan's excellent point, he's right. We have made his life tougher because we knew, even I mentioned CXC changes in the decade preceding this, even for that, that from a data perspective, you've now got a messy pool of data where you've conflated the values of sex and gender, the totally different things. And so Dan's talking about it from his experience. I mean, I talked to endocrinologists who worked at St. Paul's, and they explained to me the concept of normal kidney function based on what is happening with your hormones and what you are inside genetically. Normal value for a female is very different than a male. Now, we don't know what you are. You might actually get misdiagnosed, and this is not good for you. Right. And so part of this is we think about this from the perspective of safety and quality care. And and this is what makes it so complicated, I think. So anyways, just my little addition.
Thank you, panelists.
I can think of one more argument that I do hear from folks, and there's plenty of cisgender and transgender folks who are out loud and proud males, females, non-binary, and they celebrate that, right? That's just part of their identity, is to celebrate the gender that they are, and they don't see a point not to have it. So not that, again, it's just another argument that you hear is, why should I be ashamed that I'm a trans woman, man, non-binary person? Why should I hide that by hiding my, my letter on my card? Again, you're never going to make everybody happy.
Thank you, everyone. Taking consideration of the time, I'm going to quickly go into the next question. Might even club 2 questions from Alex together. So Alex has this question. I work at Q Immunity, where we run Trans ID Clinic. I'm interested in how the speakers would respond to the criticisms of X gender marker. Many non-binary people have been experiencing limitations in the healthcare system for the X gender. For example, LifeLabs does not recognize the marker and won't accept it. People taking on the X gender marker are finding that it actually threatens their access to healthcare and gender-affirming care. It feels like the creation of X marker was a case of putting the cart before the horse. What are the next steps to make this an actually viable and safe gender marker to choose? That's part of one question. And the extension of the discussion from Alex is, there has been some criticism around change in the gender designation process. Demedicalizing the process now means people need a lawyer to sign the documents, which can be very expensive. While the barrier to gender marker change is no longer medical, it is now financial. The overall cost of gender marker changes for trans folk is already expensive. Are there efforts to reduce these costs for trans folks?
Could I hop in on the second one there? I can't, I'm not that kind of doctor, so I can't speak to the medical side of things, but I want to make some important points here. So when we first demedicalized the process, there was the addition of a letter from or a signature from a notary or a lawyer. We heard from people that that was a new and different barrier. And so for people over 12, that's gone. So all you need is a photocopy of your ID. So Alex, I'm happy to have another conversation with you about these challenges and what you see through the Trans ID Clinic, because I'm always learning, always looking for ways to make this better. But that signature from a lawyer is not there anymore. It was there for a short window and was corrected for exactly the reason that you identified here, was that was added in by Vital Stats. And we heard from people about, if what we meant was reducing barriers, that needed to go to the previous question, and not from a medical perspective, but these are things that we continue to hear and look for solutions to. The health systems, like the computer systems, the data systems, are challenging. They're not quick to change. They differ in doctor's office versus hospitals and health authorities. But you've identified some really real challenges that we're working to address, and to talk to my colleague, the Minister of Health, and the Ministry of Health about these. I'd absolutely welcome a conversation for a chance for you to download the expertise you have from the Trans ID Clinic, for us on the political and policy side to look for ongoing solutions. So thank you.
Thank you, Grace. Next question is by Stephanie. When can we expect BC Digital Health Record to catch up to gender markers on IDs? That is, documents now say X, but internally stored information remains binary.
I'm happy to field that one. And I think, happy for Grace and Daniel to jump in here, but I think one of the things I have been working with the Ministry of Health on is the idea of what we call the longitudinal record. So the idea that all information about you end to end can be accessed by both yourself and the people that are caring for you at the right time, at the right place. Right now, BC, contextually, we have a lot of different systems. They don't speak to each other. They're not interoperable. So that's one of the pieces that will help address that. And I believe Grace can probably speak to the rest, but I think that's the gender standard that she's leading the work on should help us with the other side of it from the direction-based standard. So there's technical impediments, I guess is what I'm trying to say. And Grace has identified that there's a standards gap that needs to be addressed. And so I think that would be my take on that.
Thank you, Natasha. Next question is by Ryan. How can we advocate for organizations within health sphere to step out of the binary of gender and gendering their paperwork processes?
I'll take a small take it that. So Transcare BC, a major part of the work they do is education and connection with healthcare providers, family physicians, and beyond around how to provide gender affirming care. I use some of their resources I share on my social media on the regular, but that's part of the work that they're undertaking to permeate that knowledge and skill set throughout the healthcare system.
There is really a big desire in the health field for people to know how to do things right. And I think a lot of times people are afraid they're going to say the wrong thing. So they get nervous and then they do say the wrong thing. We had a case a couple of years ago where our lab misgendered a kid. I actually called them by their dead name. And then we're mortified that they'd done that. And they're like, can somebody please just come and show us how to do this properly? So we worked out a system, an internal system here that big green dot, nobody knows what that means, except that means look at the thing really carefully before you call out a kid's name or gender. And we try to write on there, here's the legal stuff, because we still have to go with administrative names, administrative sexes, administrative things, the legal name basically. So I think our nurses and our team has gone to many of the clinics across our thing and just say, we're an arthritis clinic. We've got 2 kids who are, we just want to be doing right by them. And so, we'll just go and do a little education session. And I think the medical students, and I know nursing students as well, and other students within the health professions are soaking up this information like crazy, like stuff I never, ever got in medical school. They're soaking it up. They're like pressing the issues and like, well, why are you saying this? Why did you just call this person that? And they're really all over it. So I think the next generation is going to be so much more, it's just going to be part of what they do versus like something that you have to learn. And I think that things are moving in the right direction. When I become Minister of Health, or maybe just even the Premier, I think first thing I'm gonna do is change all the computer systems so they all talk to each other, because it is very fragmented still, and that becomes a problem. The system that we use here, our brand new system, does not do X either. It only makes you have ambiguous genitalia. It puts you as U, which means unspecified, and it's an American system. We can't fix it apparently, and it's just a limitation of health information technology that's the commercial systems have not caught up yet either, and that's a big problem. It's gotten way better though, way better in 5 years. Like the information that I can get online from other systems has gotten way better, but it's still quite lacking.
Thank you, panelists, for all the insightful answers, and thank you, audience, for the question. Sorry, we are at 1 o'clock, and unfortunately, we cannot answer a lot of other questions. Feel free to email the host and panelists, and they'll be happy to take your questions and answer them. Thank you, everyone who attended, and to our distinguished panelists, Adjunct Professor Natasha Thambiraja, Dr. Daniel Metziger, and Parliamentary Secretary for Gender Equity, Grace Lohr, for that enlightening discussion. The Collective for Gender Plus Research in ORIS and SPPGA look forward to hosting many more similar events in the future. Thank you, everyone. Have a great day.